Some sports are starting up again. Before returning to play, kids, coaches, and parents can follow these tips to protect themselves and others from COVID-19. Stay home if you're sick or have been around others who are sick. Wash your hands with soap and water for 20 seconds or use hand sanitizer with at least 60% alcohol before and after practices or games and before and after sharing equipment. Keep 6 feet of space between everyone. This includes on the sidelines and in the dugout. Coaches, parents, fans, officials, and sports staff should wear a cloth face covering. Don't touch your cloth face covering. If you do, clean your hands. Parents, coaches, and sports administrators should decide if the kids need to wear cloth face coverings. It's most important to wear a cloth face covering when it's hard to keep 6 feet of space between people. Cover your coughs and sneezes with a tissue or use the inside of your elbow. Don't spit. Bring your own equipment, like gloves and bats, if possible. Don't share towels, clothing, or any items used to wipe your face or hands. Keep your belongings separated from others, like your gym bag and equipment, when not in use. Avoid physical contact, like high fives, handshakes, fist bumps, and hugs. Let's start the season with healthy practices. For more information on what you can do to keep players and coaches safe, go to cdc.gov/coronavirus.
I've heard people make comments like, "Thanks for bringing the virus over."
Didn't it come from you guys?
A passenger told me that I should go back to China.
I've had strangers cough at me.
People move away from me.
Someone spit 3 times towards my direction. I felt so violated. My biggest fear is that all the stereotypes that we've worked so hard to break are just going to be reversed. And I won't let that happen.
Everyone has to keep everyone else safe. We all have to play our part.
I've been spending 8 to 10 hours a day making masks.
I donate my plasma.
As an essential worker, I'm delivering food, groceries for my community.
I know I'm putting myself at a little extra risk, and I'm happy to do it.
It's really hard to talk about racism when all I want to do is cry about it.
You have to talk about it to other people. You have to tell them these things exist.
We're all human.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse, not a virus.
I'm a delivery woman.
I'm a rideshare driver.
I'm a chef, a neighbor,
Artist.
Bus driver.
I'm a doctor.
Fight the virus. Fight the virus.
As faith leaders, you have the power to use the principles of your faith to encourage everyone to welcome and support each other during the COVID-19 pandemic. You have many platforms at your disposal, including virtual services, prayers, emails, WhatsApp groups, newsletters, online meetings, radio, television, and social media to share messages of hope and keep your communities resilient at this time. Together, as faith leaders, you can help your communities overcome stigma that is often associated with COVID-19 by caring, connecting, and celebrating. Caring. Encourage your community members to show empathy and compassion to others during times of lockdowns and limitations on movement. Encourage them to speak up when they hear someone saying negative things about people who are isolating to protect their loved ones, or who are working hard to take care of people and do needed work, like healthcare workers or truck drivers. Encourage them to support these individuals and show they care. Connection. Nowadays, people can safely connect and encourage each other through texts, calls, or video. Everyone can use these connections to help reduce stigma related to COVID-19 by knowing the facts and sharing them with others. You can get correct information from trusted sources. Encourage your community to stop spreading rumors. Set up a WhatsApp support group where people can share their challenges, and together you can identify solutions to help each other. Celebration. Encourage your community members to welcome and celebrate those who take care of us, including health workers, other essential workers, and people who have recovered from COVID-19. Encourage people in these groups to share beautiful stories during your virtual services, illustrating that life is a precious gift. Globally, faith leaders are speaking up and taking a stand to help reduce stigma related to COVID-19. As faith leaders, you can prevent stigma and be present for each other in the community, emotionally, socially, and spiritually, even when we need to be apart physically to stay safe. Care, connect, and celebrate together.
I may never have met you. We don't go way back. Maybe we wouldn't even be friends if we did. But when you wear a mask, you have my respect. Because your mask doesn't protect you. It protects me. I wear my mask to protect you. Mask up, America.
How to clean and disinfect your home if someone has COVID-19. For common areas of the home. Each day, clean and disinfect high-touch surfaces and items. High-touch surfaces include tables, countertops, light switches, doorknobs, and cabinet handles. Put on disposable gloves. First, clean the surface with soap and water. Then, use a household disinfectant. Read the label to see how long you should keep the disinfectant on the surface. Have good airflow and ventilation. Follow instructions about rinsing off chemicals. Be sure to put products where children cannot reach them. To clean electronics, follow the manufacturer's instructions. Or use alcohol-based wipes or spray containing at least 70% alcohol. Wash dishes and utensils with soap and hot water or run them in a dishwasher. For sick areas or rooms of the home. A person who is sick should stay in a separate area or room and use a separate bathroom if possible. Only clean these areas if something gets soiled. This will help limit your contact. Have the person who is sick wear a cloth face covering. A caregiver may also wear a cloth face covering. Dedicate a lined trash can if available. Remove the gloves and wash your hands with soap and water for at least 20 seconds. For more on cleaning and disinfecting your home for COVID-19, visit cdc.gov/coronavirus.
As restaurants and bars decide to open up, consider these tips to protect employees, customers, and communities and slow the spread of COVID-19. Urge employees to stay home if they feel unwell. Require employees to frequently wash their hands, especially before, during, and after preparing food and after touching garbage. Wash hands with soap and water for at least 20 seconds. Have employees wear face coverings if feasible. Make sure to have enough supplies to support healthy hygiene like soap, hand sanitizer, paper towels, disinfectant wipes, cloth face coverings, and no-touch trash cans. Clean and disinfect frequently touched surfaces like door handles, phones, cash registers, bathrooms, chairs and tables, and countertops. Use disposable food service items to limit sharing of items like menus, utensils, and condiments. Use touchless payment options to avoid direct hand-to-hand contact between customers and employees. Encourage customers to use drive-through, delivery, or takeout options. If seating customers, prioritize outdoor seating. Change the layout of tables or chairs to make sure parties are spaced at least 6 feet apart. Consider installing barriers, such as sneeze guards or partitions, at cash registers, host stands, or where staying at least 6 feet apart may be difficult. Avoid large gatherings and discourage crowded waiting areas by using a phone app or text to let parties know when their table is ready. Stagger or rotate staff shifts and break times to limit the number of employees working at the same time. Remind staff to stay at least 6 feet away from each other and customers as much as possible. Post signs and posters to promote healthy hygiene habits among staff. Include messages about healthy hygiene when communicating with vendors and customers, such as in emails, on business websites, and on social media accounts. For more information and tips to consider, check out the link on the screen or visit cdc.gov/coronavirus.
This is one of the most powerful weapons we have in the fight against COVID-19. Wearing a face mask whenever you're in a public setting, combined with social distancing and frequent hand washing, are all simple actions that we can take to help slow the spread of COVID-19. Americans continue to come together to take precautions to protect others from COVID-19. We all have a role to play in slowing the spread of COVID-19 and protecting each other, even if you are young and healthy. I wear a face mask because I want to ensure that COVID stops with me. So again, wear a face mask. Stay at least 6 feet from other people. Avoid crowds and wash your hands at least 20 seconds on a regular basis. Together, we can fight COVID-19. Together, we can say, COVID stops with me.
This is a disease, I think, that has a number of sort of mysteries involved compared to the usual respiratory virus. On the one hand, we see very severe but variable manifestations. We see a diminution of immunity over time. We're really seeing a number of reports of people who report long-term fatigue, headaches, vertigo, interestingly enough, difficulties with cognition, with cardiorespiratory fitness. And I think what we're going to find out is that a large portion, not all, but a large portion of that is likely to relate to the significant cellular level damage that this virus can cause. I think it's an argument for why we take this disease so seriously. People thinking, oh, especially young people, mild disease, I might not even have any symptoms and I'm over it. Whoa, the data is suggesting otherwise. Evidences of myocardial damage, cardiomyopathy, arrhythmias, decreased ejection fractions, arrhythmias, if I didn't mention that one, pulmonary scarring and fibrosis. And then in the more acute phase, extending out for a month or two, has been this really interesting issue of coagulation abnormalities, which have been responsible for both small vessel and large vessel arterial and venous occlusion. So this can be a really wicked virus in some people. We're going to see more and more of the longer term consequences come out. And we're going to need to study those as vigorously as we did the acute symptoms, catalog them, understand them, and then clinical trials to figure out how best to treat them.
world, I have a quick message. It's about safe driving. All right, let's go. Anytime you're driving, have the seatbelt buckled tight. Both hands on the wheel and your phone out of sight. When not in your hand trying to text somebody back. Because if you do, your car might get smacked. The moral of the story, just put your phone down. The people on the road will stay safe and sound. Put your phone down, put your phone down. People on the road will stay safe and sound. Yeah.
Marijuana is now legal for adult use in Massachusetts. Only people 21 or older can buy or use marijuana products. Now that marijuana is legal, parents are asking, what do we tell our kids? The cannabis sold today is much more potent. It's also available in a wider variety of products, like edibles and vaping devices that can appeal to your kids. But children's brains aren't fully developed until their mid-20s. And marijuana has been shown to impact brain development in youth. It can affect memory, cause learning problems, and increase risky behavior. One of the most valuable steps you can take is to talk with your kids about marijuana. You're probably already having discussions about alcohol, tobacco, and opioids. Now is the perfect time to add marijuana to that conversation. Listen to what your kids have to say. Make sure they know that you want them to be healthy and safe. Give them the facts, but set clear rules about marijuana use. By the way, if you have marijuana in your home, lock it up, out of reach and out of sight of children. For more tips on how to keep your kids safe, visit moreaboutmj.org.
Hello, I'm Dr. Catherine Brown, state epidemiologist with the Massachusetts Department of Public Health, and I'd like to talk to you today about Eastern equine encephalitis, also known as Triple E. Triple E is a serious illness spread by infected mosquitoes. We had a very active Triple E season in 2019, and because this disease comes in 2 to 3 year cycles, we want to be sure you know how to protect yourself and your loved ones. While you may be hearing a lot about Triple E, it is a very rare disease. Since the virus was first identified in our state in 1938, we have had just over 110 cases. Where does Triple E occur? The majority of cases typically occur in Bristol, Plymouth, and Norfolk counties. These regions are homes to swampy areas where the birds and mosquitoes that spread Triple E live. However, in an active year, such as we had in 2019, Triple E can occur across the state. With our partners, the State Department of Public Health traps and tests mosquitoes, and we create risk maps of areas where the greatest activity in any particular year. There is no way to eliminate all risk during an active year, but there are several tools that help reduce risk, and the most important of these is personal protection. Use a repellent with an EPA-registered ingredient, such as DEET, picaridin, or oil of lemon eucalyptus according to the label instructions. When you're outdoors, wear long pants, a long sleeve shirt, and socks. This may not be so easy when the weather is hot, but it will help keep mosquitoes away from your skin. Keep mosquitoes out of your house. Repair any holes in your screens and make sure those screens are tightly attached to all your doors and windows. When risk is greatest, avoid outdoor activities between dusk and dawn. That will help you avoid bites by the kinds of mosquitoes that are most likely to carry Triple E. Our strategies to control mosquitoes include spraying from trucks and from the air to kill adult mosquitoes. Spraying can help temporarily reduce mosquito populations and their ability to spread the virus. The spray does not persist in the environment. When done at the right time and with good weather, aerial spraying can be useful as a risk reduction tool, but it does not and cannot eliminate that risk. The Department of Public Health wants to keep you safe during Triple E season. We'll be working with state and local partners to prevent this disease and other mosquito-borne illness. But we need your help, so let's work together to stay safe this season. To learn more about Triple E and what you can do to protect yourself and your family, visit our website.
She went out to eat on a Saturday night. She was fearing for her life, and the restaurant girl wasn't wearing a mask.
we're super careful. We wear masks. We wash our hands nonstop. But I one time used a pen of the delivery food guy. I swear to God, the next day I start coughing. I'm like, I go to the grocery store. I'm like, do I have COVID? Forget about it. This guy, one night he had a few too many beers. He's like, oh, sorry, honey. What are you doing?
I check my temperature each day. Every time I am afraid, but it's always just seasonal allergies. Hypochondriac, that's for sure. And I'm always checking on my temperature. Yeah, hypochondriac on the floor. And I'm stressing like I've never stressed before.
She's the best charades player.
Seriously, she went straight from the drunk to the eye roll. Like the dance to the eye roll.